Hey guys, Tony Maritato here. I want to read a post that came in my private Facebook group, the Total Knee Replacement Support Group for Kind People. This is a situation that I've talked to other patients about before. I think it's worth discussing here in the group and on the YouTube channel. So this was an anonymous post. It came in 5 hours ago, and it reads, quote, "I had to postpone my total knee replacement due to other issues, but I still am doing my exercises. Oddly, my knee doesn't hurt at all. Hasn't hurt for a couple weeks. Injections should be worn off by now, as they were more than 3 months ago. The previous injections only lasted about 2 to 2.5 months. Is it the exercises? Should I cancel my surgery?" So, of course, nobody should ever claim to give you a definitive answer, yes or no, you should or you shouldn't. But there's a lot to consider here. Now, I've been known on this channel to record videos where I said pain alone is not the best reason to have a total knee replacement, because pain is a very complex experience. It's context related. There's lots of influencing factors that go on. Interrupted sleep, other chemical changes in your body, lots of things that can generate a pain response. I find that patients who have a total knee replacement simply because of pain, but they are fully functional, don't always have the best outcome because they're looking for the outcome, the goal to be pain-free. And you guys know it. You've had knee replacements. The goal of a knee replacement or the outcome isn't always a complete disappearance of pain. A lot of patients will still have soreness, tenderness, warmth, swelling, and pain following their knee replacement, even years after their knee replacement. So for this particular individual, right now they're pain-free. Now, based on this post alone, they didn't say anything about function. They didn't say anything about stability. I find that when there are true mechanical problems with the knee, when the knee is unstable, when the knee is giving out or buckling, there's a really great chance that getting a knee replacement is going to resolve a lot of those issues, and the patient's going to be very happy because now they're going to have a structurally sound knee. Even if it still hurts a little bit or hurts more than totally pain-free, it's going to be structurally intact. But if you're just looking to have your knee replaced to resolve pain, there are other options for pain management, pain resolution. And I would say that, if you're feeling pain-free right now and you've been feeling pain-free for a little while, maybe you don't want to get your knee replaced as quickly as possible. Maybe it is the exercises. There is good clinical research to suggest that exercising an osteoarthritic joint, exercising a painful joint, will produce positive chemical changes that can reduce inflammation, can improve tissue healing, and reduce the sensitivity that's experienced as pain. But if exercising was making you worse, there's other alternatives again. So I would say, while there's no definitive answer, and I am certainly not telling you do this or do that, if you're not in a rush, if there's no other reason than pain to have your knee replaced right now, if it was me, if it was my mom, I would absolutely be looking to prolong and postpone the surgery as long as I talk to my surgeon and my surgeon says, you know what, nothing's going to get worse if we wait another 3 months, 6 months, 12 months, or whatever. So I wish you the best. Keep us posted. I would love to see how you do if you end up not having the surgery.